First of all, I mean, you keep telling us that these proposals aren't finance-driven, but then you make statements like, if Norfolk Park doesn't save money, it's a problem, you know, we need the money to go elsewhere, and so on. So it is finance-driven. I don't, you can't square that circle. The other thing on the out-of-hospital care, without going over ground that other people have covered pretty fully. First of all, if you're saying that these changes to the hospitals won't take place until the out-of-hospital community care is in place, why isn't that the first sentence at your consultation to put people's minds at rest? Consultation comes across as saying we are going to close A&Es, and then as an afterthought, yes, we're going to put this in place. It's not up front that you're saying we will not close any of the A&Es until this out-of-hospital care is in place. It's not clear to anybody at all. It doesn't appear to be what you're consulting on. And I mean, in terms of that, I mean, you said outside of London, elsewhere, people are pleased with the out-of-hospital care and so on, when London would concentrate on hospital. The figures that we quoted show that with the closures that you're proposing, we'd actually be far worse off than elsewhere in the country in terms of provision of hospitals per 100,000 in population. So I don't understand that. And the other thing is, I mean, lots of this out-of-hospital care depends on liaison with councils, providing the care and so on. Councils are having their money. Councils can't provide the services they're providing at the moment. How do you square that circle? My last point is this, on the consultation itself and the procedure of the consultation. Firstly, are the GPs, and whatever the GPs think of it, whatever the sort of balance is between what different people are claiming, are the GPs being told to consult with their patients on what they think? And I don't just mean putting a couple of bits of things on the notice board I mean actually sending stuff out to patients, informing of the changes that are proposed, and asking them to participate in the consultation. But please don't say you can't afford it, because there's lots of glossy linkages around. The health authority can afford to do all sorts of things when it feels like it. Last point, on the consultation, how are you going to decide, or how is whoever it is deciding, when all the comments are in, when all the councils have said they don't agree and so on, who and how is going to decide what the outcome of the consultation is, and will we be told how that decision is being taken?
Okay, so I think there were 4 points there. The first one, is it all about money? I'm clear it's not all about money. Certainly we have a financial envelope, we have to work with it. Anything that works for the government has a financial envelope. That's the reality, and certainly we're having to work within that. This work started by clinicians saying how do we improve care to initially we had a team of paediatrics obstetrics, and in early specialists started meeting 3 years ago because we were aware of the variability of care. At that time the NHS was having large increases in funding, but we were looking to see how we change it. So that's the backdrop. Having designed a clinical model, we then went to the finance team saying, does this fit within our financial envelope? So yes, we have a financial envelope. I've never hidden that. I work in a government where there's a financial envelope, I have to work with it. It doesn't mean it's driven by that. Second one is the documentation and how clear we are at hospital work. Everything I've ever said is very straightforward. We have to get the out-of-hospital work done right and first. That's absolutely clear. We are doing a financial model that depends in the end on having hospital changes, because that's how we can invest in the community services. So that's how we've had to do the financial modelling. If we don't manage to get the out-of-hospital stuff working, if we don't reduce the demand on hospitals, then the hospitals will be full, we can't change them. We're very clear, I've said repeatedly, all of the team are very clear, and when CCGs, typically GPs, are writing in and saying they're supporting this, they are saying they're supporting it contingent on the investment in funding community services. And they're saying that very clearly. As a GP, I've worked in Eden a long, long time. We've been promised by various health authorities there'll be investment in general practice, we've not seen it happen. So we're sceptical. I've now put in Effie and others have got financial plans where they have clear lines in their financial modelling of investment in those community services. So Effie's got the document at the back there that says there's a £10 million investment in community services in Brent over the next 3 years. I don't think that's going to be enough. We know the investment in family care is going to have to continue after the 3 years. But now we have the financial plans that outline that. Are we telling our GPs to inform our patients? What we're doing is, in all our
Nobody hears about those.
Well,
How many proportion of patients hear about PPP?
Ours meets every 9 months.
So I don't know about the details of your individual practice. My practice, we have a patient participation group. It's been meeting for 3 years or more.
But do you tell all your patients when every meeting is taking place?
Yes, we text them all. We text. Okay, well, I can only tell you about what
Those people around the room are saying they don't hear about it.
Okay, I can tell you in my practice what I do. Practices are individual groups, so they do different things. We text all of ours, we have notices up in our waiting room telling them about it. We always have a clinical theme, so we have a meeting around heart disease or diabetes, because that tends to increase the crowd. And then we have half a meeting to talk about changes in practice or changes in the NHS. And that's the way we've always done it. We find that works reasonably well. The last point, I think, was around decision. So at the end of consultation, all the feedback you'll see, we have people taking notes of all your questions and our answers now, taking notes of all the objections we have, all the letters, the emails, the meetings, the petitions, is all being collated. It'll be analysed by Ipsos Moi, who are good at analysing that stuff. They write a report on this. There's a much more detailed equalities impact assessment going on. There's more work with Transport for London.
Who will make the final decision on?
I'll get there.
Because it won't be patients with it.
It won't be patients with that. Well, actually, with all patients as well. But you don't mean, no, it's not a plebiscite. We don't.
It'll be managers, driven by the government.
It's not managers.
They come with a full of people.
Let Mark carry on with this. So we get the analysis, get the report, the quality impact assessment.
So all that data is put together. There'll be another larger paper looking at clinical risk and analysing the data on it, and seeing if we can address any of the things that people have come back to us in consultation. At the end of that, all of those details will influence what model of care we propose to the JCPCT, which is the joint committee of the PCTs, and includes Richmond, Wandsworth and Camden, because their patients are involved in this as well. They're not managers, these are non-executive directors, so people who are respected in their community and are taking roles in leading the health service, and they will make a decision in public in springtime, sometime next year when all that's happened. Part of the decision-making group will include the GPs who are leading and will therefore have to take responsibility for implementing all of this later, and they'll be involved in that as well.
Okay, I think before the break you wanted to
Yes, I do. It's as much to get it recorded actually as your answer. But I'm concerned that in the delivery, out of hospital delivery, I talked earlier about schools, that schools aren't included. And obviously there's going to be this overlap between the local authority and the NHS in terms of this kind of provision. Some of us here are old enough to remember when health was quite something to do with at school, high school nurses, preventative care, checking teeth, checking sight, checking puberty. I remember young men being put down, trained by the had to see if we were developing a little bit. That's wrong. That's a really important service, particularly in an area where there's a lot of immigration into the area. In schools where I'm governor, we've had children coming in past the age of 5, earlier when they were picked up by health visitors. We have families who are not registered with GPs. We have parents who are unable to tell us about the health issues that their children have, some of which, said before about the Rancho Hill, who stopped breathing, and it turned out there was a congenital heart defect that the parents knew about that and told us about. We need investment in preventative work there, but also screening, which would, I think, solve a lot of problems, things like TB and so on that we've been discussing earlier. In your proposals and the investment that you want to put into community care, are those kinds of things included? If not, can I suggest that they should be, and that we sort out the overlapping areas? Because we have problems in education at the moment. Sometimes health says, we don't do this, education has no issue. No, this is a health matter. Speech therapy, some of the mental health services and so on. Can we actually set up who's responsible, who pays, and who delivers?
So I think maybe slightly this is part of my borough, because the community nurses who provide care into the schools are people who community provision into the sexual health, family planning, and particular support for psychological therapies. Because as we all know, our teenage children are under huge amount of stress with exams in a way that we weren't. And they're spending a lot of time in that it's a very different model of service than it used to be. And they're providing that, and it's very effective. They call me, and one of the more enjoyable things I do is I go into 3 of our local junior schools, it happens, or primary schools, talking to parents about puberty. Because obviously girls are having puberty earlier now. It's a bit of a shock in primary school when girls start having periods and growing breasts and things. So I now go to my local schools and teach parents about puberty and puberty changes. And I do that alongside the school nurses who go into those schools.
It's interesting, just quickly, there used to be a well-made clinic in Harlesden. There's a well-known memory on Saturdays. And one of the things that they asked me as a teacher was to try and promote boys' self-examination testicles because of teenage testicular cancer and so on. And that kind of thing seems to be really important, like possibly missed out of these proposals.
Well, I mean, you have a very good point about the need for health services and local authority services to work very closely together, and there's a very strong tradition in Brent of health and social care working very closely together. And one of the things that the reforms does give us now is the emergence of the health and wellbeing board, which is now well established in Brent, and which brings together local authority people with local health.
So why are the councils opposing these proposals?
Well, I'm talking more generally about...
No, I asked a question earlier which wasn't answered. You're so proud of the Health and Wellbeing Board of Councils. Why aren't you, as with the Brent Council, opposed
I'll
to
just
these
finish
proposals?
saying what I was saying, if I may, which is...
Well, if you ever answered a question, you wouldn't need to keep
I'm
asking.
answering a question that has already been asked, not yours at the moment. So the question that has already been asked is about the importance of health and social care working together, which I'm absolutely accepting, and just illustrating that by the emergence of the Health and Wellbeing Board in Brent, which is already doing really good work around planning for an integrated system that brings together health and social care.
The Health and Wellbeing Board isn't supposed to do these changes. The Health and Wellbeing Board locally hasn't made any decision about this yet. In Ealing, although the local council is opposing it, the Health and Wellbeing Board hasn't made a decision. The meeting this week, they agreed that they would have further meetings to discuss it. And the majority of people there were supporting the changes, despite Ealing Hospital being under threat. The Health and Wellbeing Board, because it's a partnership with lots of members, aren't always taking the political opinion of the council.
Picking up on the point we find about the process of decision making and how you're going to handle the different comments that are coming in. I'm sure that from this borough, a lot of comments will be saying not to close accident and emergency at Central Middlesex for the whole range of reasons that have been given, not least of which is around the equality issue and your criteria about access to care, which clearly is not covered, and in fact it's contrary to what you're proposing to do. Do you think then there is a possibility, can you envisage, that you will decide not to close accident and emergency at Central Middlesex and look to make some arrangements so that that service remains at Park Royal?
So if consultation comes back with a strong message that there's a good clinical reason why there needs to be an accident emergency in this locality, and there's a way of making that clinically safe, and that's certainly something we would look at.
But only on a clinical basis, not on a social basis.
Not on a social basis, a basis of need.
We have to be able to demonstrate that we can make a clinically safe service.
Exactly, and you can, because you could, it's about how you direct resources, you could make it. It's about priorities, you could
It's a
make
matter of balancing out where we put those priorities.
it's priorities. I'm just wondering if you, so it is on the cards that accident emergency could be continued daytime and could be nighttime
We
open up.
haven't made any decisions at the moment. We're listening in consultation. My expectation is it will be very difficult to manage that in the sense. If there's a lot of strong necessity for that to happen going forward, then it's certainly something we will look at.
Gentlemen.
You know what you're talking about is money. Are you running us by money? Are you running us by medication? Or are you running us by the medical money? Which is, you're sick for this, you're deaf for this, etc. Now, if you're running us by money, you're just going to go on winding on for centuries and centuries or years and years. If you're running out by a medical model, you're just going to be needing more and more technology to accommodate different changes in clinical developments. And if you're running out by the medical model, you're just going to continue to get arguments after arguments, disputing this and agreeing to this and that. So which one is, where's your money, in your mouth or elsewhere?
So I'm a GP, basically. I treat people, and GPs are actually quite good at trying to treat people's disease holistically. So that's understanding there is a medical model you have to apply for, you need an antibiotic. For actually you need to do that. The more the time it's dealing with the stress, the anxiety, the social setting, and treating people holistically. So certainly that's the way I'm approaching it, is we want to improve holistic care for patients. Yes, we have to do it within a financial envelope, but that's the secondary issue.
Yes, I mentioned before that my particular GP seems to have quite difficulty in letting people participate in their PPGs, and I've been trying for a number of months now to get to a meeting. I've now been told the next one's in January, which I think is quite outrageous. But I did manage to go to the Kilburn Cluster meeting, which took place on the 13th of September. And the last item in agenda was about the closure, mergers of A&E and all that sort of stuff, which more or less fell off the agenda. There's a document by you in there. But this survey wasn't there. This survey wasn't there, and this is the first I've seen this survey, despite all my efforts to try and get involved over the last 3 or 4 months in what's going on just locally in the National Health Service. So I want to know who is getting this survey and how does it represent people? Where's it being distributed? Because I've got to the 8th of October, my next meeting's in January, the cluster meeting is after the 8th of October. Even people who want to be involved in what's going on, never mind people who perhaps don't even know, haven't seen this. I'm shocked. I'm shocked that I've seen this today, despite all my efforts to get involved.
That's the questionnaire that's in the front of the blue document.
Yes.
Okay, well, I mean, that was distributed in July into the local libraries and into all the practices.
Well, they closed 6 of the libraries.
Yes, but it doesn't help that even at a meeting, and is this online as well? Because we've been told we will be consulted online about things and we haven't been sent this. So okay, that might be my local practice, but the Kilburn Cluster meeting, which involves all the practice, didn't get it, didn't have it, didn't see it. I think that's outrageous, and I think you need to postpone the 8th of October. I really do. And I'm going to go back and make a complaint to both my GP and to the cluster people, because I think that is really... I've been trying to get involved, and this is the first I've seen it. Seriously. And I'm just gobsmacked, to be honest.
I mean, it's been available, and all the practices would have been at that Kilburn meeting.
Well, they're not doing anything. They're not. That's
what I'm saying. They don't tell people.
They're not accountable when you go into the surgery.
This was on an item on the agenda, wasn't there?
How many copies went to GP practices? Was it 1 for each patient? No, I bet it was less than that.
Initially, they were sent 50 and asked to contact the team as soon as they please.
I go in frequently to my surgery. This is Lonsdale, which has got a good reputation. There isn't like a pile of these things everywhere. I haven't seen any reference to it.
Well, the local practices will have been sent stock.
No, practices, they don't. And I might practice very good. I've got complaints about them, but they certainly are not with this sort of stuff.
So can it be postponed? Seriously? Can we do more to that? It's a genuine question. I'm not just trying to make a political point.
We're not expected to. I mean, clearly the decision of how long we consult with is something we have to agree with the councils at the beginning of consultation. And at the beginning of consultation...
Do you have a consulting?
At the beginning of the consultation, they agreed with the method of distributing leaflets and posters and documentation. They agreed that 14 weeks was allowable. The rules around consultation...
14 weeks over the summer as well.
The rules around consultation say you should be doing it between 2 and 12 weeks.
I understand.
We agreed we do it for 14 weeks and the
No, I
councils...
can understand that, but how many you had replied?
But it was agreed, wasn't it, overview and scrutiny on, when was it, Monday? That, or Wednesday, that it would that you wouldn't be held to the 8th of October, that comments can come after that.
We're agreeing we're taking documents later. Clearly, we want them as soon as possible because it makes it very difficult for us to analyse things that come later. We recognise that a meeting, Ian's Health and Wellbeing Board is meeting again on the 15th of October, and we're agreeing we'll take the documentation.
Okay, I'm very aware it's just after 1 o'clock. So if we take one or two last final questions, and we're everyone's got to go at 10 past 1. So, Graham,
I mean, you can't doubt, if I might say so, Mark, you can't doubt that you've been, very energetic in coming around meetings and be prepared to debate all sorts, and somebody's no doubt about that. But I'm left with the impression that, and it's nice to hear you say you're against privatisation and so forth, but I'm left with the impression that we are powerless to changes except, to say anything that will make any difference. If NHS North West London wanted to consult, there wouldn't be 30 people here. There would be hundreds. Because that's what happened in Ealing when it was properly publicised the other evening, when I saw the picture of 350 people there. In fact, in Ealing there was a march of 5,000. Here 2 weeks ago there was a march of over 200. But nobody knows about this meeting. It's unfortunate, I'm afraid, you mentioned the libraries, because of course Brent Council is nationally famous for having closed 6 out of 12 libraries, including the marvellous local here, Tokington Library, which is now closed. But these things all add up. But I think to the audience here is that there's no chance, because patients don't have a say in the NHS and never have actually. There's been a 60-year deficit in democracy in the NHS, and it's never been fixed. But it is a very political process. And one advantage we have, with all the passion there's been about defending accident emergency, is that this is a marginal seat where the MP locally, Sarah Tedder, is refusing to oppose the coalition government plan to close our A&E, which the doctors here. Unfortunately, I think they've been put into the firing line because the politicians are running away and they've asked Ethicon and Mark Spencer to come here and defend it, this £1 billion cut in our services. And because it's a marginal seat, and Sarah Tedder has now been sacked from the government, I think that is where we should focus our energies as a campaign. That actually is politically unacceptable to the people in the poorest part of North West London to have their A&E closed and to see the other changes which are going to take £1 billion out. So that's why the NHS Patients Campaign in Brent will carry on, because we will be concentrating on political lobbying, and we will be targeting the politicians like Sarah Tedder and the government ministers next, along with the other campaigns which we support. That's all I can say really, because I don't think there's any chance of this consultation doing anything but rubber stamping what Dr. Mark Spencer told the BBC 4 months ago, which is A&Es are going to close whatever people think. And indeed, he went further. He told the Ealing Gazette, and I know the Ealing Gazette doesn't record properly, but I've certainly got it right here, that you lose sleep if this cut isn't made. You're going to lose sleep at night if these cuts are not made. And I think we will be losing sleep if they are made. So there is no ground for compromise with them. We must do everything we can to defeat North West London NHS and the bureaucrats, like the gentleman who's come today, who are doing the Tories' work for them and destroying our local and national health service.
So I've just read something on the consultation document, and just to say, you can do various things online, like fill it in. But the only way that you can make a complaint about that consultation procedure is to write a letter. You can't phone. The phone is to get different types of things. The online is, so everyone has to write a letter if they want to make a complaint about. That's what it says here. That's what it says here.
Having emails and phone calls.
But that doesn't. Okay, I will try it because I'm clever enough to do that. But other people seeing this, if they wanted to make a complaint saying they haven't seen it, would have to write a letter, and most people won't. You know that.
Okay. Is there any final point or final question anyone has before we wrap that up? No? Okay.
Can I just ask one thing, if I may? Is there any patient here who supports the closure of A&E at Central Middlesex? No. There are not. Can that be recorded? That's twice this week in Harlesden. Thank you, Mark, for coming. But patients don't want it.
Okay, thank you all very, very much. Thank you for coming along. Enjoy the rest of the weekend. we're staying